May I invite as our next speaker, Dr. Anisha Tresa Augustin. She's an assistant professor at Amala Institute of Medical Sciences in Thrissur.
Good morning, all of you. And I would like to thank KSOS for giving me this opportunity. So, as you all know, change is something that is inevitable. And of late, there has been a paradigm shift in so many things. And I would like to introduce to you Roundtable Interactives, which is a new way in which your CMEs can be conducted. This topic will be of particular relevance to those who are planning to conduct CMEs in the future. We recently conducted an RTI session at our institute a few months back. It was hugely successful and we got a lot of positive reviews. So that is why we decided to introduce this topic to all of you. So our conventional CMEs are usually too crowded. There will be less of audience interaction. Cannot be used much for hands-on sessions. You can have unlimited participants which are more difficult to manage. And of course, you have to manage the spot registrations. So coming to the next generation CME, that is the Roundtable Interactives, it helps you to contribute ideas more freely. More one-to-one interaction is possible. More active participation from the candidates. Better attention span because you have only a limited time. You can pick and choose your learning combo and more topics can be discussed in detail. It has a structured format which gives you more hands-on, especially useful for diagnostic tools and surgical procedures. More topics are covered. Because your delegates are pre-booked, you can plan your questions and inform which areas have to be clarified, and your speakers can also be better prepared. Now, at the organizational level, there are a few things that you have to be careful about. You need more space, more funds. You have to deal with more faculty. You will have to have better technical support, audiovisual arrangements. You have to restrict the number of participants, otherwise your RTIs will not work. You will need to have so many number of participants for each slot which are pre-booked, otherwise it will not work. And no spot registrations can be encouraged. Of course, it is a teamwork. You have to divide work among your team. So how do you go about it? Decide on the number of round tables in each room. You can have 3 to 4 round tables maximum in each room with about 5 to 6 participants per table. Decide on the number of slots, size of the table, number of participants per table. Allot time for each discussion. Choose topics which can be covered in that time schedule and they should be crisp and precise. Decide on the speakers and moderators for each slot. There should not be any overlap of topics. All registered delegates should be pre-booked, and the most important thing is time management, because you should not have people waiting at the end of your hall to get into the next session. Correct at the end of 1 hour or half an hour, whatever is the decided time slot for that period. Within that time slot, make sure that the talk is over. Now, technical aspects. So how do you make sure that things happen without an issue? So what we did was we made a Google form and also registered an app called Form Choice Limiter, which is available on Play Store. And the numbers were amenable to change if wrong entries occur. The Google link of your Google form should be entered in your Form Choice Limiter so that when candidates register for your CME, they will be able to book your slots in the Google form itself. And once they have booked their slots, they cannot change it. The Google link has to be embedded in the e-brochure, which makes registration much easier. And for the speakers, it is better that they are given a Bluetooth-enabled speaker and mic, an interactive whiteboard, LED screens, laptops should be provided. So it gives more mobility for the speaker that ensures more interaction, and make sure that the halls are soundproof. Now, when we conducted the RTI for the first time, there are a few issues that we faced. Multiple Google forms were filled by a few candidates. So what happened was, multiple slots got blocked. So we had kept our slots at 15 participants for each slot. Now when you fill more than 1 or 2 forms, what happens is the number of slots available for the next candidate reduces. So since they informed us prior that such a mistake has happened, we were able to correct it through the form choice limiter. Of course, we had more faculty to coordinate. For a single CME, we had around 30 faculty members. So that was a bit difficult to coordinate, but we managed it. We needed more funds and of course, efficient AV support. So in a nutshell, when you compare your roundtable interactives versus the conventional CMEs, RTIs are more interactive, more topics can be covered, the delegates can customize their CME, less delegates to manage, but of course you have more faculty in hand. No spot registrations will be entertained. It is more technically demanding, you need more funds, but definitely it is more successful and I think it is better of an academic experience for the delegates. Thank you.